So this is something you will see commonly and you might not think to include in the differential diagnosis. So this is a young adult paucicellular cystic lesion posterior to the manubrium and anterior to the great vessels, so kind of in the upper anterior mediastinum. And this is a little bit of benign thyroid follicular epithelium. This is the conventional pap smear with colloid and macrophages. And in the thin prep, the colloid looks like this little folded or wrinkled tissue paper. So it's a benign thyroid cyst. It's just that the thyroid is a little lower in the anatomic perception than we would expect it to be in most settings. And that's great news for the patient. You know, it's not a germ cell tumor or any of those other things that would be in the differential diagnosis. So here's a 68-year-old woman with an asymptomatic large solid anterior mediastinal mass, this big goober here. It's discovered on chest x-ray, so she has no symptoms from this lesion. She has a image-guided FNA, lots of little blue cells in the background, which are lymphoid, and then a few scattered cells that are a little bit larger, some of which have a more spindled morphology. And if you look at the edge, you see those lymphoid cells falling off more readily. Those spindled cells in the background can be difficult to separate out because of crush and smear artifact from the intrinsic lymphoid population.